I'm pleased to announce that BC will be the first province in Western Canada where trans and gender-diverse people will have access to publicly funded gender-affirming lower surgeries within their home province.
It's being called a game changer for the transgender community. Health Minister Adrian Dix says those who identify as trans in BC have advocated for better care for years. Up until now, those wanting such surgeries had to travel to Montreal or the U.S. away from their families and support system.
Anybody who's had any surgery knows that that's a difficult moment, and you need your community around you.
As someone who's traveled out of province to access surgical care, I know today's announcement will have significant positive impacts for gender-diverse British Columbians and their families.
Gwen Halworth traveled to Montreal in 2004 for her surgery, a time when access to care was more challenging, time-consuming, and costly.
Out-of-pocket costs for me at the time that were never reimbursed by anybody else was probably about $35,000.
Approximately 100 people leave BC every year to have this surgery, which can sometimes lead to complications. Those who have gone through the experience say having it done closer to home will improve surgical outcomes.
Someone has gone blind because of the surgery, because of blood loss that was not looked after, and there were some mental health consequences on some people that could have been easily managed if the surgeons had been here. From my own experience, knowing the pain I went through getting back to Vancouver, I would not wish that on anybody.
Transgender people will also have access to gender-affirming chest and breast surgeries in 7 BC cities, including Prince George, Kamloops, and Kelowna. Lower surgeries will be available within Vancouver Coastal Health starting in 2019. This initiative is expected to reduce wait lists significantly.
I am an articulate white lawyer. I have very few barriers navigating healthcare, and I've been waiting 15 years for the procedure that I had last month. It is not a question of creating need that wasn't there before. The need has existed. We're just going to be giving people medically necessary healthcare now.
In Vancouver, Mary Cranston, City News.